Today I am going to show leafy vegetable preparations. Firstly, I will tell you the importance of leafy vegetables. Leafy vegetables are having highest calcium, highest minerals, and calcium is very important for kidney patients. Minerals also very important, since in chronic kidney patients all these things will get disturbed. Low sodium level, low calcium level, low chlorides level, etc. And here the advantage is it's having less protein, less than 3%, the too easily digestible protein. And also it's having highest fiber. If you eat this more than 50 to 60% with pulses, 5%, you will not going to get hungry. Otherwise you will get hungry, you will eat more bread or roti or chawal, rice, so then automatically the creatinine level will go up. So now I am showing how to prepare. So before that I will explain, then accordingly you can understand, and also you can download the PDF in the description and you can prepare accordingly. First is any leafy vegetables. It has to be mixed with any pulses except horse gram and red gram, and with any dry vegetables like a potato, onion and garlic and ginger and green chilies, coriander, etc. And after boiling that, the released water has to be separated. And the solids has to be taken out. The released water can be used as a soup or sambar or saru, whatever the format for others. But whereas the solids, after taking out, it has to be given tempering, what we call tadaka, or we can call vaggarne in Kannada, with half a teaspoon to 1 teaspoon ghee, with all other ingredients like green chilies and chopped onion. So thereafter, the quantity which the patient is required, it has to be taken out, and for remaining quantity, salt has to be mixed into for the entire family members. So the patient has to consume by using 1 gram salt. Then you will really enjoy it. Otherwise, if you do boiling these leafy vegetables and thereafter if you give some tadka and all, the patient will not enjoy. You should prepare in such a way for the patients. If you become patient, can you eat that food? So like that you should question in your mind. So then only you can give the best food to the chronic kidney disease patients. Because as I told you, the food is the medicine. Thank you.